Good morning, everybody. Happy Saturday. Welcome to this Saturday's edition of A Different Perspective. I'm Dr. Zach Papendieck from our Wellness Way down in Appleton, Wisconsin. And I mentioned that I'm from Appleton, Wisconsin, more for the Wisconsin part of it because of today's topic. And today's topic is a fun one, talking about vitamin D. And vitamin D, when I decided I was going to do this as a topic, my first thought was, well, this is going to be a good 6 minutes of information. If you have low vitamin D, take vitamin D, and all right, problem solved. But there's a lot more to it, and as I'm sure a lot of you know already too, the more you learn about vitamin D, the more you're amazed by it and realizing how important it is. So I want to go over some of the finer points of that. But starting out, I want to tell you a little bit about even just how I came to learn about vitamin D. And it was out of necessity, as you know, most often. But having, even just getting started in practice, now we're going back about 11 years ago right now, I think it is. And I had a patient come in and had all kinds of neurological signs, like lightning bolts in the arms and a lot of pain in between the shoulder blades and up in the neck. And it was just ridiculous how bad it was. And he had a lot of headaches, and I mean, he was in his late 20s. It's not like he had been dealing with this for years and he was, just getting older and applying the pain to that factor. But having it be something that he was dealing with every day, he couldn't even work, and he was working in construction. So he was just kind of plowing through it and just making do, but he was so fatigued, he was so tired and just in pain all the time. So he went into the doctor, and after they did a neurologic workup on him, they did an MRI, and when they got the MRI report back, they said, well, we're seeing some little white dots and some different things that we can see within the MRI of your brain, but right now it's not enough to diagnose as a condition. Right now it's not enough to treat with a medication. So let's just keep an eye on it and see how things progress. And that was it. They just kind of left him with that. So in explaining what was going on to a lot of his friends and family, everybody was saying, hey, you should go in and see a chiropractor. And after he heard it, probably 15, 20 times, he decided, yeah, maybe I should look for a chiropractor and go in. And lo and behold, he found me. So when I first, met him and went through everything, I knew, okay, we got to start getting adjusted, because he had just a ton of muscle tension and a lot of the issues that he was dealing with. I knew that if we take away some of the stress on his spine and stress on the nervous system, he should see some improvement. And knowing, just the backstory and the health history that he talked to me about, I felt like there wasn't enough that I was doing when, getting him adjusted. I wanted to learn a little bit more what else I could help him with, and I really didn't have anywhere to go. So finding, what he was doing on a regular basis, he was drinking about a 12-pack of soda a day. And it wasn't just because he really liked soda. It was because he was so tired that was how he was staying awake, because he would go from different construction sites and different job sites, and he did a lot of driving around the state of Wisconsin, that he was drinking soda in the car just to stay awake so he didn't fall asleep while he was driving to the next job site. So first thing I told him, you got to stop drinking soda. And then he's like, well, what should I do that is healthy? Like, well, and I'm just thinking, okay, I've had, 15 minutes of nutrition education, since graduating from chiropractic school, which, yes, it was more than that. Did the state certification for nutrition and get my license for that. And the only two things that came to mind are, I'm like, okay, he's got nerve things going on, and his immune system probably sucks. How about some vitamin D and some fish oil? I think anybody that's watching this video and me just describing what's going on with his nerves and everything else, you're probably thinking, yeah, you should probably take some fish oil. And, vitamin D can be helpful. So, knowing that vitamin D, and even just this picture that Heather created for us, that's got all kinds of different things on it that a lot of times are associated with vitamin D. It's the thing at the center that is usually the first thing everybody thinks of, and that they should think of, is the sun. So knowing that, what I gave him for recommendations, aside from getting adjusted on a regular basis, and I was seeing him pretty often, that he started to have a lot of really dramatic improvements, and seeing a lot of those improvements right along with just the basic for the advice I gave him is stop drinking soda, take vitamin D, and take fish oils. Heck, I didn't even have vitamin D and fish oil in my office at the time to sell to him. I was just telling him, go and find some. You need to get some, you need to take some, and just take whatever the bottle says. That's really where I started. I just knew that if we're doing the basics here, I just wanted to make sure I wasn't missing anything. So after even just the first month, there was a dramatic improvement, and he wasn't having nerve signs anymore. He wasn't having a lot of those issues. And all I had done was just give him that basic advice. So my thought process on that was, what the heck else am I missing? And what else do I need to know about what's going on within that nervous system and what he was dealing with? Because there was a lot of inflammation. I just didn't know to what extent or what else was going on. So having that process and just starting that, search and that, idea that vitamin D is doing a lot more. It's where we're getting it from food. That living in Wisconsin, usually the best advice is you got to take some supplements. You got to just make sure you got a good vitamin D supplement, and that's going to get you what you need. And as long as you don't have a vitamin D deficiency, you should be fine. And at that point in practice, I kind of had the exact opposite motto of what I've got right now with the Wellness Way, in that I was just guessing. I didn't test anything. I didn't tell them to go get a test. I just said, take these things. They're going to help. That would be all you need. And knowing that now it's the exact opposite, guess what? It's just that much more of, a reason why we need to take some of these is when you got some evidence or you got a physiologic need. So vitamin D we can get from a lot of different sources, and we're going to dive into the food part of it. We're going to dive into the sun, but in Wisconsin right now in late January, and it's snowing outside and just awful. Not really a whole lot of sunlight for us to use right now, but everybody knows that vitamin D is good. But I feel like not a lot of people know why, and sometimes it doesn't really matter why, right? You just know it's good, so let's take vitamin D every day, and that should make me feel better. And I know that's where a lot of people kind of stop is, all right, I'm taking vitamin D, and then if they're not feeling better, well, son of a gun, this vitamin D doesn't work. Or maybe I need to take more and they'll double up on it, or take, a little bit more during certain parts of the year where they're not outside, not getting more sunlight. So having that idea that vitamin D is good, but not really knowing why, that's why I want to go over just some of the different aspects of why vitamin D is good and some of the things you may not know that vitamin D is doing for you and why it's so important to get tested to find out what your levels are. Because it's knowing that if you think it's good and then you have that, that supplement that you're taking, you go, okay, a little bit is good, a lot more must be even better. So I'm just going to take a ton. Is it possible to have too much of a good thing? Yeah, that's true for a lot of different topics, but especially with a class of vitamins that we've got that vitamin D is a part of. And that group are fat-soluble vitamins. So vitamin A, vitamin D, vitamin E, and vitamin K, all of these are fat-soluble vitamins, which means a few things. It means that they can accumulate within fat tissue, and you can become toxic of having too much. But the other part of it is you actually need to be able to absorb them within fats. They need to be delivered within fats, and you're going to find them within fatty foods. But vitamin D, as we're going to be talking about, what it's made of is going to limit where you're going to be able to find it in natural forms, in natural sources. So sometimes the only option for people really is to just have it be on a supplement list and have it be something that they're taking every day, and knowing that they're getting their adequate amounts, because we know where minimums are. And where minimums are is not anywhere near what we need for optimal function. So having the idea that there are some vitamins that you got to be careful of. Vitamin A is not one that, often is going to be something that people have a worry about having too much of. Usually the food form that you're getting it in is beta carotene, which isn't, it's harder to get to toxic levels. You can get, it's the orangish pigment that you'll see in carrots, but it's in a lot of other things too. That beta carotene is an antioxidant. Same idea with, vitamin D and vitamin E. Vitamin E is a great antioxidant, but is there only one form of any of these? No, they come in a lot of different forms, and vitamin D, often in the supplement form, you'll see is that it's in the form of vitamin D3, or what's known as cholecalciferol. Big fun name to say. But vitamin E, you can get in a lot of different forms, and it's used as a natural preservative because it is an antioxidant. But there are some forms that can actually be dangerous, and actually there's some that have been in the news. One form of vitamin E that was in the news that they're basically figuring out that that's what has been causing a lot of lung issues for people that are vaping and having that really damage their lungs. It was a form of vitamin E that they're using as a preservative within all the other toxic ingredients in there, that it's vitamin E acetate, which doesn't really matter for today, but there can be harmful effects when these things are processed, and even just how they're used, because it's not going through the right routes. And the vitamin K that one usually you're going to read about when you try to Google anything. You know, hit Dr. Google for some vitamin D information and you're going to be overrun with the need for vitamin K. And vitamin K is an easy vitamin to get. It's an easy vitamin to find. And when in doubt, dark leafy greens. Dark leafy greens are going to give you just about everything that you need, with some exceptions. But vitamin K, there's huge amounts of vitamin K in kale. And just the fact that not a lot of people are eating a lot of dark leafy greens is why you're going to find that whenever supplementing with vitamin D, you need to have this much vitamin K. It's true, but you should be getting it from food forms. It's that vitamin D doesn't come in food forms in a high amount. That vitamin K, you can always have extra amounts. There are some people that need to be careful with vitamin K because vitamin K is something that helps in the clotting process too. So certain types of medications, certain vitamins can actually make more efficient or less efficient. And having a clotting issue, vitamin K can be a problem. So some people need to be careful of vitamin K. So there's lots that, on an individual basis can change, but not everybody is going to just say, okay, if you got this much of vitamin D, you need to have this much of vitamin K. It's not the same for everybody, but it's a good guideline. So that's why you'll see that a little bit more often. So vitamin A, vitamin D, vitamin E, vitamin K. Whenever I see, just the list of vitamins, gotta tell you, there's a comedian that it just always made me laugh. It was from a while back that he said that whenever somebody started naming all these vitamins, they got vitamin A, and then they got vitamin B, and they're like, wait, we better slow down. We're gonna run out of letters. So we got B1, B2, B3, B4, B5, B6. They're like, okay, this is overkill. So we went to B9 and then B12. They're like, all right, this is too much. So vitamin C, vitamin D, vitamin E. And then there's no F and G and H. We just go over to vitamin K, and that's kind of where it stops. So what the heck's so popular about vitamin B? We got all these darn numbers. So yeah, that's just every time I look at vitamins, like why the heck do we have so many B vitamins? But the word vitamin, and I know I talked a little bit about it on the leaky gut video I did a while back. The word vitamin, I like looking up word origins and finding out where they came from or why it is. And vitamin, that was always an interesting one to me because really what it breaks down to is vital and amine. So amine, like amino acid, the building blocks of proteins. So they named vitamins because they thought these were things that were vital for life, and they thought that the only way to get them was in proteins. That's how it got its name. So furthest thing from the truth at this point, knowing what we know, especially when we've got these fat-soluble vitamins. But as we look at what they're made of or what the molecular, buildup of these things are, there's a wide variety of them, and they are used in so many physiologic functions that vitamin D is something that, you can see how many different ways it gets used and what the body is doing with it. That knowing what the structure of it is and what it is in general, that's part of where, as Dr. Patrick always has his light bulb moment, we're going to get to that in a little bit, but it's knowing what vitamin D functions to that's where you start to just get your eyes opened up like, holy cow, this thing is way more important. What do I need to eat or what do I need to do to get more of it? And then finding out, oh no, you can have too much of it. What else do I need to know? So having that basic structure of it, when you see, or when I saw the structure of vitamin D and started learning about what it's made from, and I'm thinking, it is something that the structure of it is resembling something else really familiar, and everybody knows the best way to get vitamin D, and I always joke with everybody and say that vitamin D is the cheapest vitamin on the planet. It's the most inexpensive vitamin because the best way to get it is just go outside and roll up your sleeves. It doesn't cost you anything to go outside. It doesn't cost you anything to get extra vitamin D. Now, can you get a vitamin D overdose from being out in the sun? I think, I forget who it was, maybe it was Dr. Jesse, tried to make a bad joke about vitamin D overdose is a sunburn. So you try to get too much at once and you got a sunburn. So I don't know. If that's funny, let me know in the comments. And then Dr. Jesse watching this video will know if it's funny or not. But what is it made of? It's a sterol. Its base and what it's created from. What happens when sunlight hits our skin? There's a whole process that has to happen before we have vitamin D. And there's a lot of steps along the way that everything that vitamin D is doing has got, these different forms that can be physiologically active or inactive, and how it's signaling different things. It's got a wide range of functions. It's got a wide range of benefits that it has for us. That learning about the jobs of vitamin D now, every time I think about it, this is the picture that comes to mind. It's knowing that our Swiss watch principle and talking about how all the gears in the body, all the different systems in the body are working together. Vitamin D is a part of every single one of these. Because we know that when the sun hits our skin, we make vitamin D. So we've got the skin on there and the integumentary system. Having the sun hit your skin activates something to create vitamin D that then gets into the circulation. But even then, it's not vitamin D in the form that it's actually going to be active and doing something for you yet. It's just in circulation and needs to be taken to another step. That then the next step is actually going to the liver. And the liver converts it a little bit more and then puts it back into circulation, and it gets to the kidneys, and the kidneys are the ones that activate it even more. So we've got this multi-step process that's using multiple organs to activate vitamin D, and along that whole process, it's got so many different benefits and all the different jobs of vitamin D. I'm just going to put a few up here, and I even actually just paraphrased a couple or shortened up a couple, because there's so much that vitamin D does that talking about it regulating blood pressure should not be confused with, if you have high blood pressure, take vitamin D and it'll make your blood pressure go down. Doesn't work like that. But some people are told that if you have vitamin D deficiency, it's going to create high blood pressure. There's so much more to the story in that and how vitamin D is working that we've got to look at a lot more in terms of testing. We got to look a lot more in terms of your diet, what your body is even just going through in response to, whether it's an allergen or emotional stressor or physical stressor. All those things are going to affect all the different gears in the watch and all the different things that we've got, that all these different jobs can be affected, but some of them will be affected more and some of them will actually be just fine. So some people will get their blood pressure increase if they got a vitamin D deficiency, and other people, blood pressure will be fine and they've got a vitamin D deficiency. So everybody can be unique, everybody can be different within that process, but having it be something that, you know, is this happens, then this happens, it's not always true. So what everybody knows about vitamin D is that it makes strong bones. You got to have vitamin D in order to have strong bones. And when we talk about the amount of vitamin D that we need, which notice I didn't give you guys amounts and numbers and how much to take yet. We'll get to that kind of. There's some definite knowledge behind why those numbers are there. And it's really having everything to do with just making strong bones and developing strong bones. Because when you don't have enough vitamin D and you have a vitamin D deficiency, rickets or osteomalacia. Osteomalacia is basically softening of your bones. And I'm sure you guys can Google up a pretty cool image of osteomalacia, and what you'll probably see is somebody with really bowed legs. Because as they're walking, how soft their bones are, they'll actually start to bow out because they can't withstand gravity and just the weight bearing that somebody is walking along, that those bones will actually start to bow from the pressure. So having very low vitamin D levels means that we aren't making very, very good matrix within the bone and very strong with the mineral content. So all the different minerals that I've got listed up here, biggest one is calcium. So part of what vitamin D does in its signaling is in your intestinal cells. And on the cell lining, there are little calcium receptors, or calcium transporters, I should say, that in your digestive tract, when you're eating things that have calcium, which guess is a big source of calcium, dark leafy greens, I could just say that all day long, that calcium, magnesium, and iron, and zinc, and phosphorus, all the things I've got listed up there, dark leafy greens has got all of those, but it's up to your intestinal cells to be able to absorb them. So having those little calcium transporters, those are hugely important, and I know a lot of people have concerns about getting calcium levels up to a good amount because they're worried about osteoporosis. Not so much osteomalacia, but osteoporosis. What do we do when we think we're going to get osteoporosis, or to try to prevent it, is take high amounts of calcium. If you're taking high amounts of calcium, you can get some big time issues because your body, what it's doing with the excess calcium, if there's an inflammatory process going on, you're actually going to be putting that calcium in places that it may not be needed, where you think that it's going to be directed to the bone, but you need a lot of other communicators in order to get it to the bone. But to get it into the system, vitamin D, that's one of the biggest things it does, is it actually tells your enterocytes, your small intestine cells, it tells them, make more of those transporters and put them at the surface because we need to bring in more calcium. So we start to absorb more calcium in the GI. It can actually increase your calcium absorption by 20 times. So taking vitamin D, having it at an optimal level, you can actually get a lot more calcium into the bloodstream that then you've got a higher amount that then can be stored in the bones. Because 99% of our body's calcium is actually stored in our bones. We've got a very, very important amount that is very tightly regulated within the bloodstream. And why do we need that amount that's in the bloodstream, and why do we need that amount to be so tightly regulated? Because it's absolutely necessary for our nerve function, and it's absolutely necessary for muscle function. Calcium is integral for being able to fire a nerve and to be able to contract a muscle. Without calcium, those things don't happen and we're dead. So you need to have a perfect amount of calcium in the blood, and there is a ton of different hormone responses that try to control calcium as it's going up and down. So what are some of the other things that we need to be looking for optimal vitamin D levels? The calcium absorption is a part of it, but it's the things I kind of just mentioned of the immune system, the nervous system, and then the last one on there, hormone production. And that's usually what a lot of people learn about vitamin D, is that it's not so much really a vitamin. It's got all these different jobs that vitamins really don't act like that. Vitamins aren't really creating a ton of activity and having the ability to go into a cell and change its physiology, because what it does with vitamin D, it actually goes inside of the cell. It doesn't just bind to the outside of that small intestine cell. It goes right into the inside of the cell and stimulates the increase in those transporters by attaching right to our genetics, right to our DNA, and telling it, make more of those proteins and increase those, and then we start bringing more calcium in. So if you're taking a vitamin D that has if you're taking a vitamin D that has a ton of calcium in it, that might actually be an overload for your body. So it's one of the things I always tell people is try not to take high amounts of calcium, but making sure vitamin D is optimum. Eating the right foods is going to get you what you need. Vitamin A, vitamin E, and vitamin K, those we can see in a lot of different food sources. Vitamin D, that's hard to get in food, so making sure your blood levels are optimum. Vitamin K and B vitamins, a lot of those are going to be made within that normal environment of the gut, which is really where we should be getting them no matter what. So immune system, I put on there just the little tidbit about it fighting viral infections. It really helps with lung function and helping to fight viral infections, that it's part of our immune system signaling that you're going to get a whole lot of that vitamin D activity with our immune system, just helping us to fight infections or prevent infections by signaling our lymphocytes, signaling the guys that are out there fighting, like the Mr. Pac-Mans, like Dr. Patrick likes to call them. So what is vitamin D made from? Obviously, the sun is a popular answer, but a lot of you already know this, and I'm sure you already had put them in the comments there. But what is vitamin D made from? Let's look back at what it looks like again, and then let's look at what it's made from. There's some similarities there. Cholesterol. Cholesterol is what is activated by the sun. So what's so special about the sun when it hits our skin? It's something that everybody's usually scared of, radiation. So ultraviolet radiation, when it hits your skin, when it hits that cholesterol molecule, it transforms it. And it transforms it into something that then gets put into the blood and put into our circulation, that then can go to be activated by the liver. Now, what is creating the cholesterol in our body? What makes a huge amount of cholesterol on a daily basis for us? The liver. So the liver, in effect, is making something that then gets to be a part of our skin, which it's a part of basically all the cells and tissues in our body because it's structural as well as functional. That cholesterol is made by the liver, packaged up, sent out to those tissues, and then it can be activated and then sent back as a different form that can act like a hormone. It's amazing. So seeing cholesterol and vitamin D and just how close they are, it's that interaction with the sun and then also our liver and our kidneys and activating it, getting it to a form that will actually be something that your body can use differently. It's why we can have the immune system be affected, your blood pressure be affected, because what's the major organ that actually is regulating your blood pressure? There's more than one, but the kidneys are actually a big part of that. Because what's the kidney's job? Filter your blood. It needs to have adequate pressure in order to do that, and if it feels like it doesn't have enough pressure to be able to filter everything out, it'll send a hormone out to increase your blood pressure. And if vitamin D is lacking, we can get some problems there. So having that little comparison in the picture, it's like, yep, cholesterol is fat soluble. It's a steroid. It is a steroid-based hormone that we look to for cholesterol levels, that if somebody has low steroid-based hormones, guess what? Cholesterol should increase. If we've got testosterone on the low side, cholesterol should increase to be able to build it. If we've got low vitamin D, we should have cholesterol increase to be able to build it as well. So cholesterol levels are important for rebuilding, and that's why hormone production is something that vitamin D can actually be signaling in too. So having the jobs of vitamin D, we know the benefits of it. What about if we've got low vitamin D? What's causing it, or why do we have low vitamin D? There's a lot of reasons, but right at the top of the list is the sun. And having a lack of sunlight, that's what living in Wisconsin is all about. And I know some of you watching this are down in the south and always making us jealous with pictures on Facebook, but stay tuned to the end. I've got some pictures to make you jealous as well. But what is it that we need to do to get better vitamin D absorption and be able to have adequate vitamin D levels? Remember, it's a fat-soluble vitamin. What is helpful in your body absorbing fats, breaking down fats, and getting them nutrient-wise absorbed into your bloodstream? It's the gallbladder. How many people have gallbladder issues? How many people need gallbladder support? I know we do stool testing on a regular basis at the office, and we see lots of people that have a hard time digesting fats, breaking those down, which means we can have some deficiencies that even just supplementing is going to be difficult to correct. That sometimes going through the GI, if there's tons of damage and we can't really get much in the way of fat absorption, that sometimes we need to do some things topically. And I know that sometimes I get asked, can you just write a prescription for a vitamin D vacation? I want to go down to Florida just to get my vitamin D levels up. Guess what? If I could do that, I'd be a lot more popular. But it is something that I've told people, when's the next time that you're going on vacation? Go somewhere that's going to be down in the south. So having the lack of sun be, the easy one and the fun one, there are a lot of things that we need to work on that if we don't have the opportunity to be out in the sun and in the south, then we've got to start working on what's going on in the GI and what's going on in the liver, because those are going to be a huge part of what's keeping those levels from going up. So what else we got up here aside from the gallbladder? Inflammatory bowel disease, Crohn's and colitis. If there's a lot of damage in the GI, it's going to have an impact on not only absorbing vitamin D, but maintaining levels. Because when we have a lot of inflammation, our body uses vitamin D regularly too, and we can have lower storage. We can have that process be something that isn't actually building back up, but it's using it as you're taking it, it seems. And what do we got up here on the next one? Stress. Stress seems like it's a part of everything. Emotional stressors. When you have a lot of stress, whether it's emotional stress or otherwise, and cortisol goes flying up, cortisol actually works against vitamin D. And cortisol is going to be something that needs to be tested on anybody that's got either short-term stressors or chronic stress and chronic inflammation, because cortisol is something that works on inflammation. But if it's really high, sometimes that can keep you from being able to get your vitamin D levels up. So what's a good amount of vitamin D level to take, or a good amount of vitamin D in a supplement to take? Depends on what your levels are and what your blood levels are reading. That should you just get vitamin D tested once? No, you got to get it tested multiple times. And knowing that what you're doing in between, that's what's going to make the biggest difference. Because the other things we got on here, with food sources, there are some good food sources. It's just that not a lot of people are eating them. Not a lot of people are having the good food sources of vitamin D and even getting enough of those to be able to get to the levels that are going to get into optimal function. Because we'll be missing out on a lot if we just think, I'm just going to have a few things that I know have some vitamin D. And what you'll find out is there's a lot of junk that you think has good vitamin D that it really doesn't have any vitamin D. And I'll give you some examples of that as we go. But imbalanced hormones, insulin is a hormone too. Insulin resistance, and I know that it's a common thing for us to test with vitamin D and see that it's low. And more often than not, on a retest, we'll see those levels get right back up. And I've seen, within a few weeks, people's levels for vitamin D go from very deficient right to optimal ranges and where they should be. And it's something that checking and testing, it's knowing that when you are making changes, you want to see that those are responding. And if you had your vitamin D test and it's low, and then you retest on it when you're doing everything right, and your levels are still low, there's something else that's keeping it from increasing, and that's part of why you need to retest. It's not just to look at it and go, okay, everything's perfect, we can stop taking vitamin D. It's knowing what else we got to be working on. And those that are diabetic, vitamin D plays a huge role in insulin signaling, and insulin sensitivity and insulin resistance is something that will really mess with vitamin D levels and vice versa. So metabolic syndrome and fatty liver disease, Dr. Jason talked quite a bit about that. It's knowing that with fatty liver disease, it's usually a sugar issue, and they used to only see it with high alcohol consumption. So non-alcoholic fatty liver disease is now a thing because of the excess amount of sugars. So knowing what the liver's function is, remember that Swiss watch. increasing on your vitamin D means you got to have good cholesterol that's increased to be able to have those building blocks, and then for it to be activated and then turn around and then processed by the liver so it can then be used by the kidneys. There's a lot of processes there that depend on the liver, and if it's really damaged, your vitamin D levels are going to be tanked because of the fact that the liver is needing some extra help. So imbalanced hormones, estrogens and extreme high estrogens as well as extreme low estrogens can be an issue, but estrogen dominance is the one that's usually associated just because of how that even interacts with insulin. And knowing that vitamin D and estrogen levels, I mean, a lot of these, just hitting that good old Dr. Google, you're going to find that so many of them are just kind of tied together that when there's an issue with one, it's not necessarily caused by the issue with the other. It's that a lot of times they're happening together, and it may even be because of a whole separate reason too. But these are the common reasons of why. But that last one that's on there, asthma, this one's a fun one. If you look up asthma and vitamin D, you're going to find a lot of awesome research. You can find a lot of awesome research papers that tell you that those that suffer with asthma are very, very common to be vitamin deficient, especially with kids, but it has a lot to do with immune system inflammation and immune system stress. And if you give somebody that has asthma vitamin D and you correct an insufficiency, a lot of the research says that they see improvement within their asthma symptoms just by giving them vitamin D. But can you have too much of a good thing? Yeah. And some people can actually have too much vitamin D that can then induce asthma. And there's a whole lot of research on one side that says too much vitamin D or giving a lot to the supplementation of vitamin D with those that have asthma will cause more asthma. And then there's the other side that says they need to get vitamin D and it helps with their asthma. And both can be right. What's the problem is you don't know who the person is and what their individual needs are. So it goes back to the we don't guess, we test. Because we got to know what it is that their levels are, because if they are adequate and you're giving them a whole bunch, now you're causing other issues. So asthma, and if those are suffering with asthma, there's a lot of triggers for the immune system. Vitamin D is trying to help it out. And we got to be really just getting back to the basics on what your body needs. So lots of different things that can not only disrupt what our vitamin D levels can be, but also that low vitamin D can then create some of those issues as we're going along too. So it's that thought process that you get to where you're like, okay, vitamin D, vitamin, and I know I think I had it on one of the slides before where in the jobs of vitamin D, I put quotations around vitamin. It doesn't really seem like it's a vitamin and what its function is and what it's doing. That vitamin D, and a lot of you guys already know this because you've heard me say it, you've heard a lot of other Wellness Way doctors say it. In fact, you probably saw it just from looking up vitamin D and trying to find out more about it and if it can help you. That knowing what it is that your vitamin D levels are is the step one. But all the other factors that go on around it, sometimes it just gets your head spinning. But the light bulb moment for me came when I started learning about that first patient that I had that had those issues, and I gave him fish oil and I gave him vitamin D, and things started to get better. And my first thought was, why? Why the heck did it get better? Why is it that that made such a huge impact that getting adjusted and taking fish oil and vitamin D changed his life so much that I wanted to know more about it? That what I started to learn is that vitamin D really isn't a vitamin. It's all those different signalings and what the liver is doing, what it's activated, and what it's closely related to. That vitamin D really isn't a vitamin. It's actually a hormone. So is it a vitamin? Is it a hormone? It's really actually both. And it's, how it got started being called a vitamin is because of just the simple process of if you have too low of this, it causes this disease. And vitamin deficiencies typically will do that. And giving sufficient amounts corrects that disease, and then osteomalacia or rickets will disappear when somebody has sufficient of that nutrient, that it's a vitamin deficiency, and that's where the focus gets put. And often that's where it stops, is bone health. Take vitamin D for strong bones, and that's all you need to know. But you need to have adequate vitamin D because it's a hormone, because it's signaling your immune system. It's signaling so many different pathways that when I think of vitamin D and the fact that it is a hormone, we call it hormone D, but I don't know if that will really catch on. It's not very catchy. But I always go back and think about the Swiss watch. And with vitamin D, it's not so much that I'm thinking of it as a hormone that's working with all the different gears. I kind of think of it as the grease within all of those gears, that it's making them all work that much better because it's helping them communicate and helping them signal and going back and forth, and it's at the center where the nervous system is concerned. That's how my process started with learning about it. With that patient that was basically told, and I know I didn't even say it before, but with the MRI that he had and all the little white dots that they saw in his MRI, was the early signs of multiple sclerosis. But they said it wasn't bad enough to treat. It wasn't bad enough to, to do anything else, that we're going to keep an eye on it and come back in for another MRI later on, and we'll see if it's progressing. And if it does progress, then you bet they were going to take action. But until then, it was wait and see and figure out what else you can do in the meantime. And the simple things made a huge improvement. Now, did it cure the white spots that he had in there? No, because he went back in for MRI and they were still there, but they hadn't done anything different and they hadn't progressed, which is great. But knowing that multiple sclerosis, what is it? It's an autoimmune condition, the immune system. And the immune system is attacking the lining and the protection for our nerves and in the central nervous system. So there's inflammation in the nerves, and vitamin D, if you do a little simple Google search of multiple sclerosis and vitamin D, you're going to find a whole lot of helpers in terms of that inflammatory process and the signaling in it too. But nervous system, obviously a big part of it. It's the grease in all the gears that really is a good way to think of it, because vitamin D deficiency is going to be there when there's a lot of other issues going on. Remember what it's made of? Cholesterol, and having a very common medication that most people will come in on their first visit, having a statin or like Lipitor or Prevostat, all the different cholesterol lowering medications, that it's really smart to test their vitamin D to see where they're at. And I use an example within some of our talks, and it's a patient that came in that was put on a statin and just felt more and more symptoms and just felt awful and was feeling the side effects that are real common with pain, but it was just feeling awful. That's why he went into the medical doctor in the first place. That he wasn't really interested in work, and he was just kind of like, ugh, and really his sex drive was going down. And it had a lot of signs of testosterone being low, but the blood work that they had done showed that his cholesterol was high. And cholesterol is high, that's their next step, is put him on a cholesterol lowering medication. And when he did that, he started to feel just that much worse. And went back into the doctor to say, you know what, I don't want to take that anymore because I don't want to feel like this. And kept the appointment because he just wanted to make sure that the doctor knew that he was off that med. But the doctor looked at his results from his retest and said, oh yeah, you look healthy now. Cholesterol's back in the normal range. And the other issues he had was he was way out of range for blood sugars. So now, knowing what you know about how vitamin D is working on a lot of these things, his blood sugars being out of the range and his cholesterol being high, that even just looking at the lab levels, I know it's probably difficult to read if you're watching this on your phone, but his testosterone was tanked. It was really low. And what's the building block for testosterone? Cholesterol. What's the building block for vitamin D that we got on the bottom there? Cholesterol. And when we've got a lack of cholesterol, or we're getting that suppressed or our supply cut off, then it's pretty not surprising to be able to see that those are low. It's surprising that some of these things weren't looked at. And that's what we looked at with them first. And knowing that our office is in Wisconsin and vitamin D is common to be low, I was like asking everybody, what month of the year was this drawn where there's vitamin D is 14? And everybody usually says December, January. And then that's why I get to tell everybody that, nope, this was drawn in the month of August. And then the next thought is, oh, well, he probably just works inside all the time and he's tied to a cubicle and doesn't go outside very much. Nope, works outside, he's a landscaper. So why the heck is his vitamin D so low if he's getting good sunlight and it's the middle of summer, where it's the easiest time to make vitamin D? Just go outside, roll up your sleeves, right? Well, that's the definition of what he was doing. And he still wasn't having good vitamin D levels. So high amounts of sugar, which, yeah, I was going to start today's show and just kind of joke around and say, okay, welcome to week 4 of sugar. Haha, just kidding. Because I know the no sugar January right now, everybody's going strong. But talking about sugar, I know I still have to talk about it a little bit. Because sugar, and especially fructose, high fructose corn syrup and high amounts of fructose by itself actually will degrade vitamin D. It'll impair your ability to have good levels of vitamin D. So having a ton of sugar, and thinking back to that first story I was telling you guys about, he was drinking how much soda driving around? It's like a 12-pack of soda a day, like 6 on the way to the job, 6 on the way back home, just so he could stay awake. And having that amount of sugar he's having, holy cow, he probably had a huge vitamin deficiency that me even just saying, follow the instructions on the bottle wherever you buy it, just get yourself some vitamin D, was all it was doing was correcting a deficiency. It probably wasn't even getting him anywhere near optimal levels, but I didn't know because I didn't even test. So low cholesterol, low testosterone, and low vitamin D is a pretty common picture for me to see. But sometimes, and I mean, this guy, he didn't really know much, you know, in terms of the way of like, okay, what else do I need to be looking at? He knew that testosterone should be tested, and that's part of the reason why he came in. But it's looking at the bigger picture that sometimes I sit down with patients and I know they've got that much more knowledge and they want to get some things tested and they know something's up, but they've been at every, you know, follow-up, every yearly physical and every opportunity to talk with their medical doctor to say, why the heck are things not going in the right direction? And I have one patient, and this, I mean, I just got to put this test panel up here, and even if you can't read anything on there, if you can see the colors, that's all you need to see. That there's just tons of red stuff on here. And this patient came in, and when I saw, you know, and this, you know, it's some of the things I look at within a health history is what somebody does for work and who they know that that also comes to the office. And this person just said that they saw us from the internet, but also had some friends that were coming to the Wellness Way up here in Green Bay, Wisconsin, and she's an RN. So when I saw that, I go, awesome. I can talk about some physiology things and kind of be a nerd with her. And when I sat down and talked with her, her main concern was blood sugars and that she was diabetic and that she wanted to get her levels back in the right range, and she was doing everything possible. She was eating right, and she was following every possibility of what it is that she needed to be doing with nutrients and making sure that she wasn't overdoing with added sugars and all the things that she knows that will affect her insulin. And that's something that she thought she was on the right track, and then went back in for her yearly physical and got her blood work done, and her A1C, her diabetic numbers, just kept getting worse and worse. And she was banging her head against the wall, just driving herself crazy, trying to figure out what she was doing wrong. That when I sat down with her and looked through her medication list, she was on a statin, she was on metformin, blood sugar lowering medication, she was on the main things that the doctor said this is what they need to do, and then this was my initial blood work with her. So if you can see it, awesome. I'll read some of it. The A1C, hers is at 7.2. Anything over 6.5 is considered diabetic. Her cholesterol panel, her triglycerides are high, which is related to sugar intake, which she said she was trying to avoid as much sugar as possible and do everything she can. That her cholesterol is at 165. Medical doctor said that's great. That's healthy. That's way too low. Below 150 is critical. I don't like it being below 150. And when seeing that that level was that low, awesome for that conversation with her MD, but it's really cutting off her body's supply of being able to really have good liver function. Because that's what cholesterol med is. As you probably have heard from Dr. Greg, Dr. Patrick, Dr. Jason, all of us are just like a broken record. Vitamin D is another part that I am a broken record about. But having her cholesterol panel, she's got very low on what they call the good cholesterol. No such thing as good or bad cholesterol. And the bad cholesterol is in the good range, below 100. Those things aren't telling her that she's healthy, and she knew there's some things going on. So when I saw that she was on a statin, and when I saw that she was on metformin, and I saw what her last year's test results were, and her A1C was always high, first thing I asked her was, did you know, or did somebody talk with you about the fact that being on a statin can actually increase your risk of developing diabetes? Because what she told me was she had no blood sugar issues until just a few years ago. To which then I asked, how long ago did you start that cholesterol lowering medication? Just a few years ago. Oh, okay. So let's look back at the timeline and see what was changing during that time, and her diabetic numbers just kept getting worse during that. So I asked her that, and she goes, no. And remember, she's an RN. She's been through the schooling, and she's like, nobody ever really told me about that. So being where she works is a good place to just kind of lean over and go, hey, doctor, can you tell me a little bit about if taking a statin can increase your chances of diabetic problems? And she talked with her doctor, and he's like, well, yeah, I suppose that actually can, that can cause a problem. That can be an issue. And she's like, well, why didn't you tell me? I'm sitting here thinking I'm doing all these things wrong and thinking that I'm supposed to be getting healthy, going everything's on the right track now. And her vitamin D level when we did our initial blood work in the office is at 11. Guess what? She was taking vitamin D. She's taking 5,000 a day, which what's the level that usually you'll get in a medical setting for the upper limit or what they don't want you to exceed? They don't want you to go anywhere over 2,000. She was more than doubling that. She was taking 5,000 and she was severely deficient. Was it because she just wasn't taking the right form? No. It's because she had some liver issues. She had blood sugar issues. All of the things that are in that Swiss watch that we need to address in order to be able to correct those insufficiencies. But knowing that that's statin, that's the first thing she went and talked with her doctor, and she goes, you know what, I'm done. I'm not taking that. And when she discontinued that, and I gotta tell you guys, when I tell you this, doesn't mean just change all your medications and everything's gonna get better. She stopped taking her statin and then waited till her next blood draw and checked her A1C. It went down to 6.2. It went down a full point. She wasn't in diabetic range anymore. And all she did was stop a medication. She was livid. She was angry. And she came into me and said, why didn't anybody tell me this anymore? Why did it take me having to go through this for a few years and then coming across the Wellness Way online and sitting down with you to just have that light bulb turn on of, holy crap, I know that that medication affects the liver. I didn't realize vitamin D relies on the liver in order to be healthy, and the blood sugars rely on vitamin D as well as liver function. So there's so much tied together. When I looked at that picture, it didn't scare her, even though she knew what all the numbers meant. And the CRP is the inflammation number, and hers was hugely elevated. So there's a lot of stuff going on there that we can't just look at it and go, oh, I better just give her vitamin D and her blood pressure is going to get better and her liver is going to get better and inflammation is going to go down. We just need a ton of vitamin D. Not really. There was a lot of other things we had to change, but sometimes it's what was toxic that's causing the problems that needed to be addressed first. So thinking about, even just where I started this whole conversation with nerve health and the Swiss watch having the nervous system at the middle of it, it has everything to do with inflammation. Why vitamin D is the grease on the wheels, so to speak, within that, or the grease on the gears within that Swiss watch, has everything to do with inflammation and how our body's trying to control it for fighting infection, whether it's in the lungs or in the brain. And seeing something like this, there's a lot that needs to be worked on. It's not just one thing that needs to be addressed. So when I started looking up a little bit more research and having some things that vitamin D does as its main job, it's that thought process of going back to that MS patient, or what was basically like pre-MS, that I started looking a little bit more at that time of why and how does vitamin D work and what else do I need to know about it. Then I started looking up just a little bit more on multiple sclerosis. And within this, and I know I don't expect you guys to be able to read all the tiny print, but it's a review article that's looking at a lot of other research papers for what role that vitamin D plays in brain health. And some of the biggest things that are on here are vitamin D deficiency in the development of dementia, the development of some things that can be related to Alzheimer's, and the development of type 2 diabetes. So diabetes mellitus is listed right in there. But that's only a blood sugar issue. What does that have to do with nerve health? These things are all related. That's why it's a Swiss watch. It's not just one gear hanging out working by itself. So with multiple sclerosis specifically, this is one of the things that I don't think a lot of people know but should know, and it's just reinforcing the idea that you got to know where your vitamin D levels are. So multiple sclerosis and vitamin D, there's a lot of research in this field because just what the benefits of vitamin D have for the nervous system, that the main role of vitamin D in multiple sclerosis appears to be how it modulates the immune system, how it's trying to control inflammation. So it's active in the inflammatory component of multiple sclerosis, and that systematic moderate vitamin D supplementation of MS patients is recommended. Groundbreaking stuff, huh? They need vitamin D, wow. So I've got just a little bit more within this actual article, because I just think it's kind of funny how they phrase it, where they've got this connection and this thing that we know is important, that what it's actually working on within the immune system are those lymphocytes, T and B cells, and how it's working on the general immune system, but it's also a neuroprotector in the central nervous system. So it's needed. Vitamin D supplementation has multiple beneficial immunomodulatory effects. And I've seen, there's different ways to describe it. Pleiotropic is one of the words, where it has many effects, many helping effects. And then there's also the extraskeletal benefits is another way that you'll see it. And that just means that it helps more than your skeleton be strong. But right down there at the bottom, it says, well, until more information becomes available, vitamin D supplementation for MS patients using a moderate physiological dose, essentially correcting their insufficiency, is recommended. So really all it's saying is that if somebody that has MS, just try to get them a little bit more and it can actually have a huge benefit. In the middle of that, it's got that 50 to 70%, it's 50 to 70% reduction in their relapses And with MS, that's one of the types, is relapse remitting, where it's really bad and then it seems to get better, and then it's really bad and it seems to get better. And it's vitamin D that can actually reduce some of those things just because of its effect on inflammation. So just getting out of an insufficiency or just having below, for blood levels, and that's something that I'll go into a little bit more, but 30 to 100 is usually the average range where you're going to see it. And between 20 and 30 is where it's deemed an insufficiency. So for those that have just a little bit below 30, we just need to get them just above 30. And I know people have had their blood tested and they see their vitamin D levels at 31 and the doc says, that's good. You don't have an insufficiency or deficiency, doesn't put you at risk for soft bones, you're good to go. Not always true, right? So aside from just knowing that it's important, vitamin D, we already know it's the best way to get vitamin D is in the sun. Where is it most common that MS shows up? I've got this handy little map that I came across in a research paper that 40 and 40 here, as we're getting closer to the equator, really anything above 37 for the line of latitude, 37 degrees latitude, above that, it's a much higher risk of getting multiple sclerosis. So the red is the high risk, and then probable high risk where there's not as much information. The white is, there's a lot of other things that they have still to figure out in terms of the numbers, but the orangish yellow that's all through the middle where the equator is right here is where there's basically low risk of getting MS. It's where you have the highest sun exposure. So being further away from the equator puts you at risk for multiple sclerosis. Does that mean that a vitamin D deficiency causes multiple sclerosis? No. But it means that adequate vitamin D can help protect and help your inflammatory process within your immune system to protect your nervous system. So that way it reduces the risk of developing. Because remember, it's an autoimmune condition. Something still needs to trigger the immune system in order to damage the nerves and damage their insulation. So, Swiss watch principle. Can I beat this thing a little bit harder? It's working everywhere. And it's knowing that once you do get adequate sunlight and it gets activated, goes through all those steps, how and where your body's using it, that usually is kind of alarming that you can still be deficient. That if you're getting adequate vitamin D in the sun, and that's why I like this picture, that there's a lot of good vitamin D sources on there, and there's some really crappy ones on this picture too. That's why I liked it. It made me laugh when I saw it. The sun, perfect. Eggs, I'll go through that. Mushrooms, they're decent, not a ton in there though. There's the fatty fish I mentioned earlier, and then we've got some cheese and some milk. Not great sources of vitamin D. And I'll go a little bit more in depth on that one too. So food, not a great source of it. So usually what do people have to do in order to get their vitamin D levels up, depending on where you live, is take a supplement. And that's a big supplement. And I made it really, really big on this picture because usually people feel like they have to take a lot. And it's like, okay, I need to get a big bottle of it. So here's a big bottle of sunshine, as I like to joke around too. That vitamin D3, that's huge. It's the form that your body makes when the sun hits it. It's what it gets to in that circulating form that then can be activated, is D3. There is D2, and there are a lot of other very long names that the sun activating cholesterol becomes 7-hydroxycholesterol, which then turns into cholecalciferol, and then calcidiol and calcitriol. I didn't want to turn this a different perspective show into a chemistry class, so I kept all of those big crazy words and all of the processes off of there, because it's something that I know is like, okay, go back to what I really need to know, because chemistry is not my friend. But I told you, that's why I look at sometimes what people do for work, because I want to know how much I can nerd out with them and be a little bit more scientific in terms of my terminology. But sources, you guys already know the best sources. And looking at this list, do you see what I did? Food, supplements, sunlight. What order are these in? They're in order from worst to first. Food is the hardest way to get vitamin D levels adequately. Supplements are probably the easiest way, but the best way by far is sunlight. But that's still something that people are afraid of. So I'm going to go over them in order of worst to first here, and food we'll go over first. Because food, really knowing what's the minimum that you have to have, here's where we'll get into some of the numbers. The basics for vitamin D levels, what are called RDAs, or your recommended daily allowance, that's something that you need to have that amount for a certain reason. And that RDA for vitamin D depends on your age, and it's 400 to 800. So who needs 400, who needs 800? Depending on your age, here it goes, here's the breakdown. From birth to 1 year old, you need 400. From 1 year old to 70, you need about 600, and 70 and above, 800. So from 1 to 70, everybody's the exact same, right? But really, what is that RDA? And I've got it on there, and I'll repeat myself after I show you the next slide. RDAs are not intended for optimal health. They're not intended for optimal function. The RDAs are there to prevent disease. Having your minimum amount that you have on a blood level, that right there is all you need to not get a disease. Does that mean that you're healthy? Does that mean you have optimal levels? Nope. It just means you won't get rickets or osteomalacia. And if you have rickets or osteomalacia, you need a lot more than 400 to 800. And knowing that 400 for 0 to 1, yeah, a 1 month old, a 2 month old, they need vitamin D. And where should that age get vitamin D from? I want to see if you guys get it in the comments. This is always the fun part. Where should somebody who is less than 1 year old get their vitamin D from? Please don't say sun tanning. Because that is one of the factors that does allow you to get your vitamin D absorption up, is actually the younger you are, the easier it is to absorb it. But no. Please don't put kids out in the side of the pool just to do some sun tanning. But what you guys need to have in the first year of life, because where are they getting it from? Getting it from mom. But kids still need to, and this is going to go on based on what mom's needs are, that breast milk should be their main source, but mom needs to make sure her levels are adequate. Mom needs to make sure that she's actually prepared to be able to give baby what the baby needs. Otherwise, there are recommendations that come straight from the good old government that tells us you need to supplement from 0 to 1 with 400 IUs in a supplement form because there's not enough in breast milk and there's not enough in food. So Dr. Jen from our office down in Appleton shared with me a really awesome research paper, because we get this question a lot of how much do we need to give the kids? How much do we need to take as a mom, whether pregnant or breastfeeding? So I did include a snapshot of that research paper from the Pediatrics Journal, and it's looking at maternal vitamin D supplementation and how much they need to take, and then measuring baby to see where there can be an adequate level. And they know 400 directly to the baby is going to be adequate for them to have healthy vitamin D levels. But they looked at, okay, how much does mom have to take without supplementing the baby in order to get those levels where we need it to be as well? And what they did is they gave mom a minimum amount, 400 to 800, and then they also gave her a little bit more, 2,400, which is even a little bit more than what the typical upper limit and where they recommend for moms. And then they gave them 6,400. And what they found is 6,400 IUs, the international units, 6,400 IUs of vitamin D supplementation for a breastfeeding mom gave adequate amounts to the child that they didn't need to supplement to the baby. Now, is that clear across the board? Every single mom that's breastfeeding, 6,400 is the magic number that's going to be perfect? No, it may be a little bit more, maybe a little bit less. Need to know what that person's needs are. But it's awesome that they're looking at it this way, because I know when even just Googling that, you're going to find out breast milk is inadequate. It's the perfect food. How can it be inadequate? Sometimes it's just what mom is able to give to the baby that will make a huge difference. So thank you, Dr. Jen, for that research paper and helping me to put together some of these slides. But knowing that I'll go back to the slide that we just had before, knowing that food is often, what we're recommended to do in order to get our vitamin D levels up when we don't have adequate sun, fatty fish, best source. How many of you are taking cod liver oil and taking it big liquid, big tablespoon at a time? That's just about your best source to get it from a food standpoint. But I know a lot of people aren't doing that, and a lot of people are taking a fish oil supplement. Take a look at the label of it. Sardines and anchovies are usually what they're going to be having in there, sometimes mackerel, and sometimes they do use cod. But it'll tell you what type of fish is on there. Salmon has a decent amount, sardines have a decent amount, tuna has a decent amount, but they're all a lot less than cod liver oil. And there's something very important about cod liver oil. Where is this oil being made from? What's the important word in this product? Liver. Swiss watch. Going right back to it. I told you, I'm a broken record. But cod liver oil, that's where a lot of vitamin D can be pulled from. And 1 tablespoon can get you 1,360 IUs on average. And cod liver oil, if we go back in time in the 1950s, this thing was common to actually be used in schools. In the beginning of the school day, they would line kids up and have a big bottle of cod liver oil, take a big tablespoon, put it right in their mouth, next one, next kid going up, going right down the line. Because they knew it helped with brain function, helped with their immune system, their nervous system. So everybody would get that. Imagine that today. Lining up all the kids in school to give them a supplement to start the day, but also using the exact same spoon with every single kid. Pretty awesome, right? So you wanna see a picture of that? Because here it is, 1950s, lining up the kids, getting cod liver oil. And does the stuff taste good? No, especially when it's the real stuff. Now you guys are spoiled. You get a vitamin or a cod liver oil supplement that's got orange flavor in it or lemon flavor, and it's got all these other things that's like, yeah, you can just drink that right out of the bottle and it's not too bad. But the pure stuff, some of you probably have some memories of cod liver oil as a child. And it's awesome for your immune system, it's awesome for your nerves because it's a healthy fat. So line the kids up and get them some real cod liver oil, oh boy. Might help out in school, right? Start the day that way. But this isn't a regular practice. And when we go straight to the government recommendations, right on the FDA, fda.gov, nutrition education, what do we have for vitamin D's listing along with all the other vitamins they have? It says right in there in green, nutrient of concern for most Americans. How can that be? Well, part of it's lack of sun, like we talked about. Part of it's gallbladder issues, like we mentioned before, and there's that other long list. But what is used for, they've got listed in there too, and some of the things I went over already. Blood pressure, bone growth, your calcium balance, hormone production, immune system. This is straight from the FDA website. How do we get it? Eggs, they have one of the worst sources first. There's like 40 IUs in an egg. Awesome. You need to eat 10 eggs a day to get to the bare minimum bottom of that 400 IUs to try to prevent osteomalacia. Some people are eating 10 eggs a day. Holy cow. Then they have fish. Herring, mackerel, salmon, trout, and tuna. No mention of cod liver oil yet. Oh, wait, next one, fish liver oil. They didn't even want to mention cod, just fish liver oil. That one should be the first because it's where I got those numbers of all the IUs and the cod liver oil having 1,360 IUs is straight from their database. So that one should be first. It's that they know not a lot of people are going to want to do it or that it's a popular amount that they want to drink or eat. But then what do we have after that? And this is why I laughed at the picture with some of the foods on there, is that we've got fortified cereals, fortified dairy, fortified margarine, fortified orange juice, and fortified soy milk. The operative word here being fortified. What does fortified mean? It means it wasn't there to begin with, or it's so low that it's really not a good source of it. So they are adding that synthetic version of it to it. They're adding a supplemental vitamin D to these foods. And part of it, I know, because it's a nutrient of concern. But if you're getting your vitamin D from breakfast cereal, you're sitting down to your bowl of Lucky Charms or Cinnamon Toast Crunch going, all right, I got to get my vitamin D for the day. We're going to have some problems. Fortifying these things is to try to just stay away from everybody walking around with bow legs because they've got soft bones and osteomalacia. It's not for health. It's not for optimal function. It's to just prevent a disease process. So fortified foods are not the way that we should be getting. And in orange juice, that one just makes me laugh the most. We talked about this at the office, Autumn and Emma, and I think Stacy was there too. We were all talking about how gross orange juice is with the realization that no matter where you go in the country, go to a grocery store, get a carton of the Minute Maid, pour it into a glass, and take a drink. No matter where you are, it's going to taste the exact same. Does every single orange taste the exact same off the tree? No, it doesn't. And how much cholesterol do oranges have? None. What is vitamin D made from? Cholesterol. So how much vitamin D does an orange have? None. But here we are led to believe that orange juice is going to give you a good amount of vitamin D. Only if it's painted on the label of the front of that orange juice bottle that it says vitamin D, and all it is because they took a supplement and dumped some in there and said, there you go, you're getting vitamin D now. It's not a food form in that form. It's actually pretty misleading. So knowing that, and I like my little surprise face down there, fortified foods are not a good source of vitamin D. In fact, I know it's the category or the column that it's there is supposed to be just made for foods, but they still should have put sunlight in there as a reminder of, hey, food not always going to do it, need to get more sunlight. Because I know kids now, what are they doing? Sitting inside on their tablets and playing video games, sitting in the computer, sitting on their phones, whatever it might be, it's not out in the sun. You got to yell at kids to go outside and ride a bike these days. Yes, I know I sound old when I say that. So, lack of vitamin D in your foods, that's not the problem. That's not what's creating vitamin D deficiencies and vitamin D issues. It's more of the things that are disrupting vitamin D that's really where the problem is. It's not that you're not eating the right foods. So thinking about vitamin D, it's not the lack of it in the foods. It's not knowing where your levels are and not knowing what you need to do to try to correct on some of those things. Because it's simple. It should be simple. We want it to be simple. But then you read, oh no, you can take too much and 2,000 is the most you should take. How much can you make when you're out in the sun? Sheesh. This is fun because nobody can agree on it. But the best way to get is sun. But what happens, and I put the picture of the liver up there because I thought it was cute. We got a happy liver and a sad liver. If your liver is struggling, if you have a lot of issues with your liver, you can go out in the sun and still be inadequate in your vitamin D. And that's where I go back to that example with the landscaper. His liver was sad, had a frowny face on it. It was sweating away. But what helps you to absorb vitamin D from the sun, I already mentioned, the younger you are, the easier it is to absorb. The more fair your complexion is, the easier it is to absorb because the melanin, the pigments in our skin, the darker the skin pigment, the darker the skin tone, will actually block your body's ability to get vitamin D from the sun. And it's knowing that if we look back at that map of where people that are more common to get MS at the very top and bottom of the map, those that are closer to the equator, a lot less multiple sclerosis, but closer to the equator, there's a lot more darker skin tones during that trip to the equator. That part of the reason for that is protection from UV radiation. When you go out in the sun, if you are fair complected, that's something that just 10, 15 minutes in the sun the next day, you're going to show the signs of a tan because going out there much longer, go out there for 3 hours sitting out in the sun, what's going to happen? Next day you're going to be bright pink because what happened to your skin is it got burned. And you can have, and I know some of you have experienced this, you can have too much sun that you get a second or even third degree burn where you're burning off layers of your skin. So you're damaging your skin doing that, so excessive amounts of sunlight is damaging. What's your body's protection against the UV radiation, against that sunlight being damaging, is increasing cells that create pigments, that create more of that melanin, that are going to actually coat and protect the skin cells. So when the sun hits your skin, if you've got a darker skin tone, the UV radiation is actually absorbed more within those pigments than it is hitting your DNA and damaging it. So small amounts of sunlight is really beneficial. 10, 15 minutes, half an hour, there's a lot of benefit to being out in the sun for that amount of time. If you're out there way too long and you burn it, your body's going to freak out. And the next day you're going to be really pink, and then what happens after that? Then you turn a lot darker of a skin tone. It's your body's response to damage. It's trying to protect you. So having an increase in those cells, some people are very, very, very light complected and they will just basically get burned and then have a whole bunch of freckles. And when you see somebody's got tons of freckles, it's just looking at tiny little spots where those melanin or those melanocytes, the little guys are actually just getting an increase in their production to try to protect all the cells around them. So your skin and the sun have a relationship, and they're trying not to get angry at each other. And when your skin is really, really burned, that's just telling you things got really bad. Living in the south, much, much easier, and I've got a little visual aid for that one next too. But living in the south versus the north, I'm talking about in the United States. Closer to the equator, easier to make vitamin D, just closer to where the sun's rays are. Midday exposure versus being right in the morning, right in the end of the day, it's just where you're getting more direct rays. So 11 to 1, that's where it's much easier to get a sunburn or just to be able to get a suntan, but really it's to be able to make more vitamin D. But if you go out in the middle of the day and you load up on sunscreen, guess what? You're blocking all of the sun's rays, you're blocking vitamin D. So you can be vitamin deficient going outside every day and covering yourself in sunscreen, you will be vitamin D deficient because you're cutting off the easiest way to get it. And the liver I already mentioned, but the last one, yes, I know, or not, yeah, that's the last one. The last one I already mentioned with the stress, it slows down the absorption and creation of vitamin D, and it has a little bit to do with cortisol and that stress response, that you can be vitamin deficient the more that we actually have that stress response going on. So where do we need to live? And the slide that I had with the whole globe on there and the MS being a lot more common, the United States was green on that map, and I didn't point it out then, but the green had its own little designation on there that it said regionally specific. It said it depends on where you're at here in order for it to be something that will give you what your risk is. So let's look at the United States here in the month of January. What we're looking at is UV index averages. So what the sun's rays and what amount of ultraviolet radiation there is. Blue is 0. Look where I am standing right here, right in the middle of the blue. So you can go outside in Wisconsin in January, butt naked, and you will make no vitamin D. Hang out in the sun all you want. In the middle of the summer, you can go outside and you can make a ton of vitamin D, but cloud cover can affect it. It can reduce UV by 50%. And knowing that in the summer, there's a huge difference in the UV index. So this is where living in the south, you still are going to be able to make vitamin D because the UV index is enough there that you just got to be out optimal amounts, have enough of the skin exposed. How much vitamin D can you make being out in the sun for a good 15, 20 minutes, even up to 30 minutes? I told you nobody can really agree on it, so you can Google all you want. You're going to see anywhere between 10,000 and 50,000 IUs being out in the sun for about 20 minutes to 30 minutes. That's a lot, especially if they're telling you don't do more than 2,000 in a supplement, and you can go outside for half an hour and be almost up to 50,000. Averages around 30,000 when all conditions are perfect. And I'm talking skin tone, time of day, where you are in the United States, cloud cover, all of the factors being absolutely perfect. That's when you can get to the upper levels of that. But vitamin D3 is what's made when you're getting the sunlight, and your body can not only create it very quickly, but it can actually degrade it very quickly and reduce those levels in the blood because it's tightly controlled. We know we don't need that. So joking around about a vitamin D overdose from the sun, there really is no such thing. You're going to get a sunburn before that happens. But having the geographical impact or where you're living, let's take a look at August. And why did I pick August? Because that's when my birthday is. Simple reason. But look at the UV index where Wisconsin is. We're right there in the 5 to 6 range. Perfectly adequate to be able to make vitamin D. Should have no problem. But what happens in the middle of summer, and especially in Wisconsin, after we get done complaining about all the snow and the ice and the awful weather and sitting inside all the time being cold, that then in the middle of August, it's like, oh, it's too hot. I don't want to go outside. I want to sit inside in the air conditioning. So, best time you can make vitamin D, and then we hide inside in the air conditioning. So we really need to know that getting that optimal level, it's, like I said, 15, 20, even 30 minutes outside is adequate. Sometimes that's just going back and forth from your car to a building when you're out running errands, and you can get enough vitamin D. So it's all the other factors and knowing what your body needs. That's where the biggest impact is that it can be different for everybody in terms of what you're able to make. But middle of summer, middle of August, it's that sunscreen that I mentioned that we're always loading up on because we're so fearful of skin cancer. And there are huge dangers of skin cancer. Where is it that skin cancer starts? Is when there is DNA damage from excessive amounts of ultraviolet radiation. So if you don't have protection from the sun, you don't have something that's protecting your DNA, excessive amounts can damage it and start that cancerous process. That there's a couple different types of skin cancer that really they just go and scrape off the skin cells, keep an eye on it, and you're going to be fine. Because it usually just stays right where it is. Whether it's squamous cell carcinoma or basal cell carcinoma, it's the melanoma that, remember I mentioned melanin and the pigments? That if we've got something that starts to really damage those cells, and those, when they grow and when they create an issue, they can actually start spreading to other parts of the body, which is why it's something that's so important to know about and get different moles checked or different areas of the skin that have interesting pigmentation. It's if the borders are changing or the color's changing. Those are the things that need to be looked at. And I taught at a massage therapy school. I taught anatomy and physiology and pathology for 6 years. And that was one of the things that I always had to tell them. It's like, you get to look at somebody's back on a regular basis with a massage, that if you see anything and you're not sure of what that is, or if it always looked like that, that person doesn't often look in the mirror at their back and go, oh yeah, it looks funny, I better go have somebody look at it. That just you being able to see it, tell them to have another person take a look at it, go into the dermatologist, just have somebody take a look at it. It's to track to see how it's changing. That excessive damage to the sun can change it. It's the damage that's the problem. But loading up on sunscreen, you will then take away all the benefit that you can actually have healthy skin with good sun exposure. So there's a balance there. It's not something that we need to just load up on sunscreen and that's going to solve the problems. You're now creating new problems. And if there wasn't even just the blocking of vitamin D being the problem, earlier this spring, we had this awesome article come out, and I say that sarcastically, that sunscreen, there's all kinds of funky chemicals in there. That's what they use to block the UV radiation, and there are a lot of different trace metals in there that are used as well. And there's one chemical in there called oxybenzone that is really toxic. But the chemicals in sunscreen, a lot of people know there are lots of chemicals in there, but being so fearful of skin cancer will make you do anything to prevent it. But what you're putting on your skin, we already know goes into your blood. And this is something that we've been talking about at the Wellness Way for years. So for this to be something that was in May of 2019, this is in the USA Today, so it made big headline news that what you put on your skin goes in your bloodstream. No kidding. This isn't anything groundbreaking at all. We know this. It's where toxicity levels, that's why it made the news. So the article itself, and this one, I've got a few spots highlighted on it, and as I was highlighting them, I was looking at it going, well, I want to highlight this. Well, I want to highlight this. I'm going to highlight this whole thing. And it's knowing what is in there that I highlighted is the toxicity portion. If the absorption exceeds, and I'm talking about the chemicals above, or the oxybenzone is one of 4 that they looked at, there were many more. Absorption that exceeds 1/2 of a nanogram per milliliter, the FDA recommends non-clinical toxicology assessment, including systemic carcinogenicity, cancer-causing, and additional developmental and reproductive studies. They want to see how does it affect development, how does it affect reproductive organs, and it's something that is toxic. Anything above 0.5. So what did they find? They tracked these 4 chemicals, they loaded people up, and by the end of the day, all of them were exceeding it. And then 3 of those ingredients remained in the bloodstream for 7 days. Does that mean that they were gone at 7 days? No. It's that they were still measuring it at 7 days, and they said, okay, 7 days later, let's see where they're at. Holy crap, they're still really high. Well, that's something to note. Oxybenzone, the one I talked about before, has been found along with other sunscreen ingredients in breast milk. So not only is it something you put on your skin, goes in your bloodstream, now it's something that's in the breast milk and something that is now within the baby. So do we want to put toxic chemicals right into the baby's mouth? No. Are you going to take sunscreen and squirt some right into your hand and go, here you go? No. Why is it that then we would be okay with having that be something that is going to be not only just exceeding that level where they say we should look at toxicology? This is actually way above. They said single application exceeded 20 nanograms per milliliter. So here is the fun part. Well, I'm going to get to this middle area where it's talking about where they're banning it, but the very bottom, the FDA previously included these chemicals on a list that needed to be researched. Okay, cool. What did they do with that? Not a whole lot so far. So on the bottom, it says before they can be considered generally safe and effective, that they needed to research them. So wait, they aren't? We don't know if they are? They still need to be researched. These levels are extremely high, goes into breast milk, and the last sentence down there says, however, the study authors note that results don't mean that people should stop using sunscreen. If my look on my face isn't enough and the cartoon isn't enough, here, let me help. Okay, they're better. What the heck are we doing? It says right on there they're toxic. It's getting into places it shouldn't be. Oh, just keep using it though. That's awesome. And the part in the middle, it's believed by scientists to be toxic to coral reefs. it's toxic to the environment. It's toxic and killing coral reefs. And we're putting this on our skin and lathering ourselves up with the fear that it's going to help us and the fear that we're going to get cancer. So Hawaii, Dr. Patrick has mentioned Hawaii many times during these last few weeks of talking about sugar, because he's going to go and get some dragon fruit out in Hawaii. That I thought it was awesome to be able to talk a little bit about Hawaii and the fact that they were the first state to ban the sale of these sunscreens that have these chemicals in them, because they are destroying the coral reef. They are destroying the life that is within the ocean that's all around Hawaii. And if you've ever been to Hawaii, it's absolutely gorgeous. But knowing that these things are destroying it, the frustrating part, I guess we'll call it, is that, yep, it was signed, this was back 2018, and it was signed into legislation, but it won't become effective until 2021. But if you go out to Hawaii, and I was out there last year in February, they have reef-safe sunscreens everywhere. The people that live out there, they know that you shouldn't be putting these things on your skin and going for a swim in the ocean, because you're destroying everything around you that's beautiful. You're destroying the ecosystem. You're destroying the life that's in the ocean, and that's going to cause us much more issues. They are trying to take away that chemical response that we see destroying things. But don't worry, it's fine to just put on your skin every day. It's craziness. So I told you that I get jealous of people sharing their pictures, when they live in the South and when they've got nice weather. Like Dr. Kelvey always likes to poke fun when it's 70 degrees down there and we're just freezing our butts off up here. So I decided to share a couple of pictures of Hawaii from when I was there last time. And knowing that in Hawaii, yeah, there's some definite nice trees. You can get a little bit of shade. But sometimes when you're out in Hawaii, and this is my favorite picture, there's really not a lot of places to hide from the sun out there. So you gotta at least have something on your skin. And when we were out on a boat where I took this picture, they had a giant, I'm talking giant, it was like this big with a giant pump on the top that had all the listed ingredients with coconut oil and a couple of trace minerals and zinc. That all the things in there, it said everything's reef safe, it's the only stuff. If they see you with any other sunscreen, they will punch you in the face, take your bottle and put it in the garbage. They don't want anybody ruining everything that is around them, because they know how important it is to the ecosystem. So they have this giant bottle, and Dr. Patrick and I were standing next to it, and he's just pumping that whole thing. He's got this huge glob and just all over. And I wish that I didn't have it all over my hands too, because I wanted to take a picture at that point, because he was just white, completely white, top to bottom. And it's because it was something that's actually protective and healthy for the skin. There's coconut oil in there and trace minerals that help to block some of that UV radiation, that you could jump in the ocean and not be completely destroying the life that's out there. So this next time that we go, I'm definitely going to get a picture of him loaded up with that reef-safe sunscreen and share it to our Facebook page as well, so you guys can laugh at him like I did. So how do we correct vitamin D levels? Oh boy, long list. And what does it start with? Get yourself tested. Know where your levels are. If you're taking vitamin D on a regular basis, which I've had patients start out, first day, look at their supplement list that they tell me that they're taking, and they're taking 10,000 IUs a day and have been for a long time, and we run their blood levels and they're vitamin D deficient. Does that mean that the vitamin didn't work? No, it means there's some other things we got to work on. So what is it that we need to work on? Is it the gallbladder? Do they need to cut out sugars? Do we have some things going on with hormones that we need to test? We can run down this whole list, and some of you are looking at this list going, yep, that's me, yep, that's me, yep, that's me. I don't have any cod liver oil. I put sunscreen on every day. All of these factors, you can be taking the supplements all you want, and you can still be very, very low on vitamin D. You still can be just missing out on a ton of where that benefit is. So doing all the right things and supporting those things and avoiding all the toxic junk. I didn't say supplement with the right form of vitamin D, supplement with knowledge. Because when you go into the MD and you tell them you're taking 10,000 IUs of vitamin D, after they fall off their chair and put themselves back on the chair, they're going to say, stop doing that, you're going to kill yourself. You're going to have too much blood or calcium in your blood. You're going to have hyperkalemia, which can lead to kidney stones. It's not exactly true. Your blood levels, if they are between 30 and 100, is very, very, very difficult, very low percentage and very low risk of having too much calcium in the blood that creates kidney stones. There are a lot of other factors that need to be going on. Dehydration is the biggest factor that will cause kidney stones. But if you're loading up on calcium supplements, and loading up on vitamin D all together, now you can actually have an overload of calcium in your blood because you're taking too much of it. Rely on food when it comes to those other nutrients and make sure where your blood levels are to know what you need to do with vitamin D. Don't just be taking it willy-nilly thinking, I'm going to get healthy just because I know vitamin D helps your immune system. There's way more to it than that. So supplement with knowledge, and basically what that means is get yourself tested and stop listening to the doctor's opinion about where 2,000 should be perfect. 2,000 IUs will just prevent a disease process. It just will prevent softening of bones. It will not make healthy bones. It will just make sure that they aren't diseased. So know what your levels are, and then the last part might be the most important. Get tested again. Just taking, an initial blood test, seeing where your levels are, and then taking vitamin D and thinking everything should be rosy and peachy keen, everything's good, awesome. No, I've had lots of people that were on a prescription for vitamin D, which they give 50,000 IUs once a week for a prescription. And they usually do that about once a week for about 4 weeks. And then what's the follow-up? For those of you who have already been on that prescription of vitamin D, which it's usually D2, vitamin D as a prescription and taking it for a month, I usually ask people that magical question, did they test again? No, they said I should be fine. What is the goal with the prescription for vitamin D? Is to not be deficient. That can accomplish it. They don't really need to retest on it because they're not looking for optimal levels. They're not looking for what other factors need to be there. And that's where I know that a lot of people have the missing piece, is what else we need to be getting tested with too. So talk with your Wellness Way doctor not only about the impact of vitamin D and testing it, depending on where you live. I mean, there are some people I tell them, I want you testing your vitamin D 4 times a year. Winter, summer, and then in between if we know that you got some issues keeping it up where we've got some other things that we're working on. But often I'll have people test at least twice a year, and it's winter and summer. Because in summer, and I tell everybody this too, I don't want you taking a supplement in the summer. Go outside, roll up your sleeves, get the normal amount from the sun. Get adequate amounts from the sun and get your levels back on track. Because knowing that, in order for us to know what we need to do and to start learning, I know that's one of the, Dr. Patrick's quotes too, that we got to start doing things to get that learning process and know what we need to do for ourselves too. So I got like my own little spin on that quote, is you need to ask the right questions. Not should I take vitamin D or what does vitamin D do, but why do I need to get a vitamin D test? Why do I need more vitamin D? Why is it that my levels aren't going up? Asking those questions, you're going to start learning a little bit more about what your body's needs are and start testing outside of that so you can look again at that Swiss watch. So, I was about to put up another Swiss watch. I won't do it to you guys. So I hope you guys learned at least a little bit about the other functions of vitamin D. But that's what I got for you today. And vitamin D, it's a hormone. And acts like a hormone, and our body needs adequate levels. So thank you guys for joining me here for a different perspective on vitamin D. And Dr. Patrick hopefully will be back in the next one and possibly with some more Hawaii fun too. Have a great rest of your day, guys.
Hey, thank you for watching. Make sure to subscribe to this channel so you don't miss a single video or live stream. Also, share this video with a friend. Once again, thank you for watching.